Hi all, this is Christian with the update for the implementation core, starting with the Discuss COPD project, which is de-implementing inappropriate use of inhaled corticosteroids in patients with mild to moderate COPD. We're conducting follow-up interviews currently with intervention and control primary care providers and a subset of patients who had a recommendation to de-implement their inhaled corticosteroids. So right after they have a visit where they would have gotten their inhaled corticosteroid de-prescribed. We're talking with a set of patients. We're in the process of doing that. We're about to launch the 12-month follow-up primary care provider survey to see if the improved awareness of harms from inhaled corticosteroids and the alternatives of LAMAs and LABAs that we observed in the 6-month survey. We're now doing another follow-up survey to see if those differences seem to persist. Our paper on baseline mixed methods findings, these were some of the findings that we've previously shared with you, such as providers' reluctance to de-prescribe inherited prescriptions. Those findings are under revision at JGIM. We did a second revise and resubmit, and we're hopeful that those will be published soon. And then we've submitted abstracts on patient reactance and the effects of the e-consult on primary care providers. Again, awareness of the harms of inhaled corticosteroids and alternative medications. We've submitted abstracts to Academy Health and SGIM. Next, we're hoping to write up papers on both of those, and we're hoping we will be helping the Discuss team refine their e-consult implementation guide in anticipation of doing some work to disseminate the proactive e-consult program. For Diamond, we've completed baseline interviews with staff and prescribers at 3 VA community living centers or skilled nursing homes, and follow-up interviews are underway at the first site. Likewise, baseline surveys have been completed at 3 sites, and follow-up surveys are underway at the first site. Next, we'll be analyzing the qualitative data, doing some mixed methods work with the survey results, and considering baseline mixed methods paper. We might also look to, if we have findings across Diamond and Discuss that would be worth writing up in a cross-project paper. 2 of our associated projects that have developed with the help of our QUERI program have gotten underway. Laura Feemster's relief study, which is de-implementing inappropriate supplemental oxygen for patients with COPD, launched and is in the process of identifying a national cohort of providers and patients, providers and their patients after the patient's been discharged with oxygen following a COPD exacerbation. We're preparing the provider and patient surveys currently. These will assess if, when, and why oxygen is reevaluated after a hospital discharge. These findings will be used then to develop a pilot intervention that will be the focus of the study. David Winchester's Career Development Award on low-value cardiac imaging is underway. He's currently completing interviews with physicians who order non-invasive tests to assess their opinions and awareness of the issue of low-value cardiac imaging. And he's finalizing the regulatory submission for AIM-2, which will be interviews with providers to understand their knowledge, attitudes, and experience of using appropriate use criteria for imaging. He's also currently conducting a systematic review on implementation of appropriate use criteria for low-value imaging. Or for cardiac imaging, to understand what's out there currently on the factors that affect implementation of appropriate use. Other activities from our implementation core. I co-led the implementation research work group co-sponsored by Academy Health and the American Board of Internal Medicine Foundation. This was gathering scholars who work on de-implementation to make recommendations about how to promote de-implementation research in this space. I co-led that with Cheryl Boyce from the NHLBI. We have a invited paper in press on de-implementation and health equity. This was an invited paper for a special issue of Ethnicity and Disease. George Sayer and I co-led a de-implementation workshop at the NIH Conference on the Science of Dissemination and Implementation. I also did a de-implementation presentation for the trainees at the NIH Training Institute for Dissemination and Implementation Research in Health. And we're considering collaborating with Samir Saini in Ann Arbor on organizing a state-of-the-art conference on de-implementation. That's something that we actually want to discuss with you all, and I look forward to talking with you in a few days.